Scene safety, scene size of, BSI, number of patients, approach patient, make a general impression, identify self and gain consent. Sir, are you okay? No response by verbal. Sir, are you okay? No response here. Painful or unresponsive. Airway, cervical spine, breathing and circulation. I'm going to let Casper take over C-spine and maintain it throughout the assessment. I'm going to look for any disabilities. I'm going to expose the patient. I'm going to look for additional resources, determine MOI, determine transport priority using cups, critical, unstable, potentially unstable, stable, and determine transport priority and how I want that to take place. And then we're going to start on our rapid assessment, which includes decap, BTLS, deformities, contusions, abrasions, punctures, penetrations, burns, tearings, lacerations, swelling, and edema, including crepitus. I'm going to check the entire head. I'm going to check the neck. I'm going to check the chest. I'm going to check the abdomen. I'm going to check the pelvis. I'm going to check one leg, and again, with all these systems, checking decap, BTLS. Check everything here, come down the arm, check everything here. All this decap BTLS, roll the patient up, check decap BTLS on the back, including spinal alignment, and make sure everything's good there. We're going to put them on a board, strap them in, and while that's going on, we're going to take vital signs and the blood pressure, pulse, respiration, skin. We're also going to do cap refill, we're going to do the pupils, we're going to do lung sounds, we're going to do SpO2, and body core temperature. From there, we're going to do sample and OP-QRST, signs and symptoms, allergies, medications, past pertinent medical history, last and events, onset, provocation, quality, radiation, severity, time. We're going to determine transport priority. Once again, we're going to put them in the back of the truck. Once we're in the back of the truck, we're going to do a detailed, which includes decap, BTLS, and crepitus for all the different systems, including with the head. I'm going to check the frontal, the parietal, the occipital, and check the nasal, the temporal, the mandible, the maxilla, the zygomatic. Look in the eyes or look around the eyes for any periorbital ecchymosis. I'm going to check for pearl. I'm going to check in the nose for any fluids. I'm going to check in the ear for any fluids, and if I see any, I'm going to do a halo test. I'm going to check behind the ears for any kind of battle signs. I'm going to check in the mouth for any foreign objects, vomitous, teeth, anything that could obstruct the airway. Down in the neck, of course, decap, BTLS, spinal alignment, tracheal deviation, JVD, or subcutaneous emphysema. Go down the chest, decap, BTLS, and then palpate the sternum. I'm going to palpate the rib cage, looking for good integrity and equal expansion of the chest. Instruct the patient to breathe if they're able to. Look for flail segments, look for paradoxical motion. I'm also going to listen to lung sounds in the Z pattern, mid-clavicular and mid-axillary bilaterally. I am then going to come down to the abdomen. I'm going to palpate all four quadrants of the abdomen, checking for rigidity, distension, softness, guarding, tenderness, and masses. I'm going to push in and push down on the pelvis, of course decap BTLS with everything. I'm going to check for a priapism in the male. I'm not going to rock the pelvis, and I'm going to look for any kind of genital bleeding. From there, I'm going to do the femur, the patella, the tibia, the fibula, the tarsals, metatarsals, phalanges. I'm going to look at the malleolus. I'm going to look at the calcaneus as well. I'm going to come along the other side. I'm going to do the femur, the patella, the tibia, the fibula, the tarsals, metatarsals, phalanges. I'm going to check the malleolus and the calcaneus. At this point, I'm going to check PMS, pulse, motor, and sensory on both sides. Checking cap refill, checking dorsalis pedis, checking posterior tibial. If the patient is conscious, we're going to have them push and pull. Make sure they can feel me touching as well, and that they can move their toes. And if they're unconscious, I'm going to do a Babinski to see if they have a response. From there, we're going to come up here. I'm going to check the acromion process, the humerus, the olecranon, the radius, the ulna, carpals, metacarpals, and phalanges. I'm going to come around the other side, do the same thing, the acromion process, the humerus, the olecranon, the radius, the ulna, the metacarpals, carpals, and phalanges. Once that's complete, I'm going to do pulse, motor, and sensory. I'm going to check for the radial pulse. I'm going to check for capillary refill. If they're conscious, I'm going to have them squeeze both of my hands at the same time to determine. I'm going to have them move their fingers and see if they can feel me touching. From that point, I'm going to recheck my initial assessment, recheck my vital signs, recheck my focus assessment, check my interventions and changes needed. I'm done.